So a lot of these long distance runners who come in with low back pain, and they just finish a marathon, this, that, and the other, it's usually coming because of. So when we're on the topic on long distance running and how that can affect the health of your spine, there's good and bad in long distance running. The good thing is that you're moving your body in a dynamic way, which allows neurology in the brain to send information to the rest of the body, the organs, on how the heart should operate more, how the tone of the muscles should start to adapt to allow you to complete certain tasks, to increase the functionality of your body. Whenever you are going on these long distance runs, the benefits of it is that you're strengthening the densities of your bone. It's called Wolff's Law. So whenever you're running and you're making that impact on the ground, your bone has to have a certain level of strength to withhold the weight of the body or the adipose tissue and the muscles. As you're completing that task, you are strengthening the bone density, which in return is slowing down chances of arthritis, which arthritis just means that there's lack of motion in between the joints. Now, when you move more into some of the negative things of running is only depending on what kind of contact your feet are making with what type of material. So if you're running on pavement, that's going to have a negative influence on your body because the pavement is going to make a shocking when your foot impacts and hits the ground in that pavement. Now that information gets sent all the way up to the joints. So your knee is going to be the one that first gets the impact, and then it will water down the effect of the energy that's gone into your knee, and then it'll go into your hip, but very lighter because the knee took most of it. And then it'll go up to the rest of the body. But each layer goes up, it gets lighter and lighter. So the thing that mostly feels every time you slam on the pavement with your foot is that knee. So you'll see something called patellofemoral syndrome, which is showing that the impact of that patella is being strained and stressed. And so then it'll cause pain and discomfort in the knees. And that's what we see in most of our runners on pavement and on treadmills. The best thing to run in is tracks because they have the rubber. And whenever you step and slam on rubber, it has a certain rebound that protects your knees. I'm also having good shoes. Some good shoes I would recommend for running would be On Cloud. Hoka's are pretty good. And overall, barefoot shoes, once you get acclimated to it, it's not something that I would just jump into if you have never walked barefoot or have never wore barefoot shoes before. I highly recommend slowly, gradually working to the barefoot shoes, maybe spending an hour walking in the barefoot shoes and then returning to a little bit of a higher sole. The key is the sole is what's causing the misinterpretation to the brain, right? So if you are wearing thick soles, that means that when you make impact with the ground, there's no way your feet is getting any proprioceptive input. So then it's weakening the information that's getting sent to the brain, and your foot is full of so much information and reflexology. So if you're never getting impact to the foot, you're taking away a major sensory organ to the body. Just like if you were to be walking barefoot, you get all this rich information because that's how we were supposed to be primarily. So then it makes our body optimal. All right. It's just like if you were to live your life wearing mittens all the time, you would be erasing so much tactile information that your brain perceives to make it richer experience for you as a human being. So that's the same thing with your feet. You have to be able to be touching the ground, getting all the micro tuning and all the little information that's being sent to your body to make it more optimal for you to live. It is a very good thing to run and good for your spine, only if you have proper shoes on, right? Which I would recommend, like On Clouds or a good running shoe that you've done some research on and you like, and it feels comfortable on your type of foot. If you have a wider foot or a high arch, sometimes there's better shoes depending on what you have going on. And then making sure that you're running on the right material, not concrete pavement, but more grass. Maybe running on track would be the most optimal thing to run on. Treadmills has a lot of impact on the knees, so I would stay away from there because that can have a negative influence on your whole spine. So a lot of these long distance runners who come in with low back pain, and they just finished a marathon, this, that, and the other, it's usually coming because of the type of pavement that they're running on, and then also the type of impact that is being shot up to the knees and again shot into the low back. So that's something you can look out for.